The Hume region's a population of about 400,000 people. If you were to travel from every branch to Doncaster and back, it's just over 3,000 kilometres. What is probably different from pretty much every other region is the wilderness response and the alpine. We put seasonal paramedics up there who respond to all cases within the snow and into the subalpine area as well with other agencies.
The Wilderness Response Program started in Hume in about 2009. The Ambulance Services Act clearly states that Ambulance Victoria will provide specialist medical treatment and transport, and it doesn't actually say where, when or how we do it. And so Wilderness Response was born out of that need to work with other agencies to give us a safe way of getting to a patient and then a safe way of retrieving those patients.
The agencies we work with, that relationship is really important. The police and SES who go out, as we do as a group, whenever we respond to something. The ambulance service never works in isolation when it comes to wilderness response. We always go out as a team, and so those people that support us in those calls and the building of those relationships and the training with those groups is very, very important. I think most of the agencies now that we're working with, they're really enjoying the fact and they've got a lot of comfort in the fact that now they can take a paramedic in with them further, and of course we couldn't go anywhere off the beaten track if it wasn't for those organisations.
Like other services and other regions, we have volunteers who've been with us for just over 10 years now, and they're an integral part to our service delivery model. We've got a number of standalone ACO teams, and we've got CERT teams. We've also got a remote area nurse up in the Walwa Corryong area.
There's two real type of people that we employ as ambulance community officers, and obviously they have to be passionate about their community and be available to respond. And we have one who are local people who provide, similar to what CFA do, in the sense that they're available, they do the training and they respond to an incident and help the paramedic. And then we also have paramedic students who live in the local area and they're doing the paramedic studies course. So they may be in their first or second year and they apply to be an ambulance community officer. They come and stay locally to respond with the paramedic, and then they get time in the job, they get some life experience. They also get to learn how to use the ambulance, drive the ambulance and assist on those high acuity jobs that they may actually not get when they enter the job as paramedics. There's gaps. As an ambulance community officer, we actually have a lot of influence for other things within the town, and not to mention what we can do for mental health. Mental health is a growing concern within small communities, just with isolation, loneliness, and us just going down the street having a coffee on the days where we know most people are going to be who are influential in the town. We can promote that community liaison.
My normal incumbent position is a Micah Single Responder Team Manager at Shepparton. I've been in that role since 2010 when the resource started under Rural Micah Ambulance Single Responder Initiative, and that was the first time that we've had 24/7 Micah coverage come into the Hume region. What it's done is actually provided a high level of care, both in the trauma setting and in the medical setting, especially around the people who are having heart attacks. That's probably the biggest impact we've seen in the first start-up. We took on the transmission of 12-day DCG program that rolled out of Melbourne, and then shortly after that we took on the rollout of pre-hospital thrombolysis, which has made a significant impact into people who are having heart attacks in the Golden Valley region. Up to date, so over the last couple of years, we've done 47 cases of people who've been administered thrombolysis.
On the 1st of December and the 4 days prior to that, I'd had a series of heart attacks and pain, and on the 1st it kicked right in, I had my massive heart attack. So the drug for me is a complete lifesaver and a game changer. It's just, if I wouldn't have had the drug before the time I got to hospital, which was a long while away, who knows what would have happened. Completely changed my life, and I think about it all the time, how lucky I was to be in the trial. To think 5 years down the track, here I am, lost weight, feeling good, and just with an appreciation of life.
Stroke care in Victoria is growing exponentially. I think in the very near future, based off some of the studies that have come out, anyone who wakes up with a stroke, I think will be driving them through to a hospital that has endovascular clot retrieval. And in the Hume region, that means taking patients further past centres, but making sure that the people in the Hume community gets equivalent care across the state.